What is going on, everyone? In this video, we will be discussing the booty juice. No, I'm just kidding. In all seriousness today, what we'll be covering is 4 different types of shots that are typically given in the psychiatric setting, and shots that I typically have to give to patients who come in with psychosis, they're not responding to PO medications well, or they're refusing PO medications due to being involuntary or other circumstances. I'm an inpatient psych RN, and I was just going to go over 4 different shots that I've typically having to give. It can be in the booty sometimes, but typically we like to do it in the arm if we have to, or PO, meaning by mouth medication, if they're willing to. Once again, please like and subscribe to the channel. This is your daily dose of mental health. Hit the like button in the bottom right hand corner. Also hit that notification bell, that bell icon in the top right hand corner, and we will jump right into it, the booty juice. All right, so the first shot that is typically given if a patient is refusing PO medication or is an involuntary patient would typically be, and this is if they have no allergies, typically would be, and this would be specifically for agitation in particular. Aggressive patients who are threatening, in particular their staff, threatening themselves to harm themselves, and we obviously first step is to de-escalate patients. That's number one, is de-escalation. In all psychiatric settings, that is what nurses and PCAs or nurse techs are always taught to do, is de-escalation. Let's say for whatever reason they're not de-escalating. I'll give an example. A patient a lot of times will be there involuntarily for having just mental illness in general. They're not safe to be by themselves, and they are typically an involuntary patient. Let's say they're saying, I want to leave AMA right now, and we tell them, look, that's not the nurse's or the PCA's decision. That's the doctor's decision, or it can be court ordered by a judge. That's who makes the decision when a patient discharges, when they're safe to leave. So if they essentially are going to not listen to us, and a lot of times they can't understand the situation because they're sick. A lot of times we will offer them PO medication, PO meaning by mouth, and if that does not work, typically in they're causing a scene, they're threatening others, threatening themselves, then we typically have to go to a shot. And typically, as I said, the first shot is a B52, and this is all based on what's their allergy history. That's why anytime before I give a shot or call a doctor to get an order for a shot, we always check their allergies. So I want to just write right here, if I can. Allergies are number 1. Allergies, because they can easily have an allergy if a lot of times a lot of patients have been here before and they've had an allergy to one of these shots, or medications. So the first one that's typically given, I did this in order, is a B52, which they get mad if we say that a lot of times, which it's essentially Benadryl 50 milligrams, Haldol 5 milligrams, and Ativan 2 milligrams. I say right here, can be given PO or IM. Typically we would offer it to them as a PO, meaning by mouth first, and if they refuse that and they're involuntary, then we would go the IM route. Also, if a patient was not involuntary and they were voluntary and they were considered a threat to themselves and they did not have a guardian, we could still go ahead and give them a shot. We never want, let me reiterate again, we don't just want to give shots to give shots. That's not the point. It's, are they a threat to themselves or others? Because a lot of times, a lot of the reasons why they end up getting shots too is because they haven't slept for days. A lot of times a B52 patient's agitated, they haven't slept in days, they've been using street drugs, they have a history of even schizophrenia or bipolar. We give them that. They take a good nap, they haven't slept in a while, they wake up completely different. And what I mean by completely different is they don't even remember the past, they don't even remember the argument we had, they apologize, little things like that. So shots are not meant for staff to just give them a shot and put them to sleep. That's not the intention. But the first one is a B52. That's the shot that I like to give the most. You can you can mix the Ativan and Haldol together. The Ativan is typically very sticky, so what I like to do is pull up the Haldol first from the vial, then I like to push it in. I like to pull the Haldol up from that vial and push it into the Ativan vial, let it mix, then pull it up because it's a lot faster. It saves you a lot of time. Benadryl by itself, and it's a Benadryl shot, then you give Ativan and Haldol. PO, meaning by mouth, you can just give all 3 meds together, call it a day. Number 2, Geodon, 20 milligrams. Typically the shot, let's start with the shot first. A Geodon shot would be 20 milligrams per ml mixed with 1.2 ml of water. So with Geodon, I'll just go ahead and say with Zyprexa, when you pull up, before you even pull up the shot, you've got to pull up, for the first one with Geodon, 1.2 mLs of water, then you have to push it into the Geodon vial. And the typical dose would be 10 to 20 milligrams, IM, and it's depending on the situation and body weight. So typically if somebody, a male, 200 pounds, agitated, you give the full 20 milligrams of the Geodon mixed with 1.2 mLs of water. A lot of times if it's a serious situation, I'd actually put close to 2 mLs of water mixed in it so you can pull it up a lot faster, because it's a substance that gets all clumpy and you have to roll it between your hands in the vial, and it can take a lot of time. Geodon is typically given for somebody who they don't respond to the B52 because they've had a lot of them or they just don't respond well, or somebody who in particular has been using PCP, this marker will not work, PCP, if they have a history of PCP use, schizophrenia, schizoaffective disorder, and once again, with all of these, if they're a threat to themselves, a threat to others, they're refusing meds, they need something, their mental status is declining, you give them a Geodon injection. If they're willing to take a PO, we do that, but a lot of times, if it's to that point, the IM will do a lot more because, once again, it all comes down to if they're not sleeping, if they've been hallucinating, you want to get them something fast. Now, with Geodon in particular, and I'll go ahead and say with Geodon and Thorazine, but in particular Geodon, when you give it to them, you need to monitor their heart rate, you need to see if there's any abnormal arrhythmias going on. Getting an EKG would be preferable. With all these medications, you can do it PO as well, by mouth, as I said. Number 3 is Zyprexa. The typical dose with this is it's 10 milligrams per 1 ml, and typically the dose when you get an order from the doctor it'd be 5 to 10 milligrams given depending on the situation. So let's say for whatever reason the doctor goes with this, so it's a 10 milligram vial, right? And it's 1 ml. Let's say they go, I want to give 5 milligrams. They want to do 5 milligrams. So that means you just give 0.5 ml of it. But typically, if it's someone of average weight, they weigh, once again, 180 pounds, you give the full 10 milligrams right there. And once again, with this, before you've got to pull up 2.1 ml of water, sterile water, push it in to the Zyprexa, and then pull it up from there. This one is typically given, I guess I could have put it before the Geodon, but this too is given as well for people, let's say they're agitated, they're seeking, they're drug seekers, meaning they just want to be, like for example, they want to B52, let's say I want that, and they want it because of the Ativan, or they have a tolerance as well, and they don't respond to Geodon well, a Zyprexa shot would be preferably given. However, Zyprexa injections are not near as strong as a Geodon or a Thorazine injection. Zyprexa also is given a lot of times daily to patients who have schizophrenia or even bipolar at night, like 20 milligrams PO, but they do have a shot form of it. But this is one of the Zyprexa and Geodon are typically 2 medications that are given daily PO if they're willing to as well. Number 4, real quick, Thorazine. Thorazine, personally, we don't give a lot of Thorazine. Reason being is it's an old school medication, has a lot more side effects to it. A lot of problems that arise from it is arrhythmias and even Thorazine toxicity. A lot of times, if they haven't taken Thorazine PO, 25 milligrams to 50, and you give them a shot, even if they don't have an allergy, you got to watch them because they can have a seizure, abnormal EKGs, heart arrhythmias. So this is typically like a last line. So let's say you have a patient who is severely agitated, very aggressive, throwing things. Let's say you've given them let's say you've given them actually a B52 or a Zyprexa injection and it's not working, it's not touching them. They have a huge history of using drugs on the street. They're hearing things. I mean, it's essentially it's like a last line drug they give. That's why I'm kind of skeptical on why they give this a lot of times in the prisons. Because I mean, I've listened to channels and I've seen this too. Somebody who takes Thorazine, it's called the Thorazine shuffle, where they literally are shuffling around like zombies. But they do have a PO form as well. But the point is if you give somebody an IM Thorazine injection, even if they don't have an allergy to it, and they don't have a history of using the medication at all by mouth, you need to watch them. And typically, the dose is 25 milligrams per ml. Typically, and once again, it's typically 25 to 50. So essentially, a lot of times, if they've never used Thorazine before and we were giving them an IM shot, you just give 25 milligrams. So it'd just be 1 ml you'd pull up of Thorazine. If they have a history of it and it works for them, you would do typically be 25 to 50, so you do 50 milligrams. So you'd pull up, so it'd be 2 vials that you'd pull up, and it would be a total of 2 mLs that you'd be giving to a patient. With this medication as well, I'll just go into it. You have to use a specific type of syringe to pull them up, because it's when you're with these vials are not your average ones. You've got to crack them open, and when you pull up the medication, when you're cracking the medication open, you have to make sure you crack it away from you, or you'll get the medication all over you, and it's like a dye. But typically, Thorazine would be, as I said, it's a last resort. And the reason why, if anyone's wondering why I said the booty juice, that's been a kind of a slang term for people who've said, oh, they're getting the booty juice. A lot of times, I want to bring down the stigma with it is that, none of these medications have to be given in the booty. A lot of them are just given right here in your arm, just right here. They're just given in your arm because why it's called that is, let's say somebody's fighting it and this has happened and you can't get to their arm and you have to have multiple people hold them down. Sometimes the booty is the best place to give it. But outside of that, I just wanted to go over some stuff in regards to what I see a lot in the psych setting, typical medications I give. It's a different video, I know, than a lot of the other ones I do, but it's mental health related. But this one, I just wanted everyone to know these are common shots that are given. So if you know anyone who's ever gotten a shot in the psych setting, you could ask them, hey, what kind of shot have they gotten? I can pretty much tell you it's probably been one of these 4 right here. Once again, please like and subscribe to the channel. I just wanted to go over some of the shots that are typically given, or PO medications. Like and subscribe to the channel, please. I will be putting out another video probably within the next 5 to 6 days. I work the next 4 out of 5 days, but I'm going to continue to put out content as much as I can. I'm going to put out a motivational video soon as well. I know I've promised somebody on that. I'll also be covering more psychiatric medications that are commonly prescribed. And lastly, real quick, I'm going to start as well covering different mental health cases, like of people who have had to go to the psychiatric setting, like celebrities and whatnot, and kind of go over some of their cases and kind of give my 2 cents on if they should go or if they shouldn't be in the psychiatric setting. So just look out for it. It's everything mental health related. Check out my last video I made. I made a video on it was random. It was something that happened in the psych setting. Check out my video about, it's called meth bumping, or meth. It's essentially just rectal meth use and how people actually use that. But it's just going to be a wide spectrum of different topics. So please like and subscribe to the channel. Leave a comment on a topic you would like me to cover. I can cover anything mental health related. So when I put out a new video, sometimes they're random like this, but it will be mental health related, everything. So I love you all. Have a good weekend. I'll be working this weekend. Leave a comment. I'll get back to you as soon as I can. Peace and love.